Alright, we've got nephritis, arthritis, and endocarditis here, guys.
That's a weird family name. The Ices. Who are these people?
Stupid question. Not answering that.
That sounds like a pretty rare case.
Or it could be just a coincidence.
You know, I think the patient might actually have Walker-Warburg syndrome.
No, but yes. It's Walker-Warburg syndrome, alright? The symptoms match.
But Dr. Hawks,
We should at least consider all options.
Yeah, maybe we can find another treatment that's less risky.
No time for that. We must do the parathyroidectomy. It might be risky, but it's what I believe is best.
We need to discuss this further, at least.
No time. Get to work. Tracy, I don't understand why you're questioning my experience.
I'm not questioning your experience, Hawks. I'm questioning your judgment. You've been wrong before, and I can't risk losing another patient to a mistake.
That was then. This is now. I'm telling you, this patient has Walker-Wahlberg syndrome.
And what makes you so sure? Your diagnosis could be off once again?
I've done my research, Tracy. This isn't a guess or an assumption. It's solid ground.
But it could also be you misinterpreting the symptoms, Hawks. I can't let that happen. We need to err on the side of caution here.
You're letting your past experiences cloud your judgment now, Tracy. This patient needs a parathyroidectomy. It's the right thing to do.
And you're trying to convince me this is different, Hawks. I'm not falling for it. We need more information before we proceed with surgery.
I've been in this game long enough to know when something doesn't feel right, Tracy. And I can assure you my gut feeling on this one is spot on.
Not long enough to know that it's Walker-Warburg syndrome.
It was an IRL typo. Shit happens, boss.
Are you a robot or something?
We need to find an alternative approach, Frank. This isn't working and our patient is in dire straits.
I know it's not ideal, but we can't afford to lose another patient on account of a diagnosis mistake.
That's exactly my point, Frank. We can't let this happen again. We need to think outside the box here. What if?
What if instead of parathyroidectomy, we try a less invasive treatment like targeted radiation therapy? I've been reading up on it and there are some promising results.
I appreciate your initiative, but this is just not something we can jump into without further research. We need to stick with the course Dr. Hawks suggested for now.
Aren't you the one who always says when in doubt, don't hesitate? This is a critical moment and we shouldn't be making decisions based on fear.
I have no idea what you're talking about. That sounds like something Hawks would say.
Yes, but you sure have spent enough time convincing yourself you are the new Dr. Hawks, and I'm convinced you would say something like that.
I am no Dr. Hawks. I'm simply better at being a leader than he is.
And impressively, with less time here at this hospital.
You're a joke, Frank. No one would take you seriously.
I wasn't talking about me. This is about...
Frank, do not go there. We talked about this. He is long gone. There's no use bringing up the past, and we have to move on. Don't you dare bring up his name.
Sorry.
You four fuckwits nearly killed him. How many times do I have to tell you people that parathyroidectomy is not a viable treatment for Mark Wahlberg syndrome? You're lucky the patient survived. You dumbass doctors.
oh, if it isn't the donkey calling the horse ass.
It's Walker-Warburg syndrome. Do you even read medical textbooks, Hawks, or just skim Reddit articles on lunch break?
Yeah, Hawks. We could really use your input on this one. I mean, we don't want to make the same mistake twice.
Well, let me tell you something. Walker-Warburg syndrome isn't the problem here. It's your lack of literacy and your inability to follow instructions that are the real issues.
Mark Wahlberg syndrome could happen to anyone.
Yeah, I guess anyone could be randomly attacked and laughed at for no reason.
Way to open up a defamation suit. We're so canceled now.
No, I wouldn't worry about it. No one watches that guy anyway. So, how have things been over in oncology lately? I've heard some good things about your team's work on pancreatic cancer, but I could use a bit more details.
Oh, it's been busy but productive. We're seeing great results with our new treatment regimen. But you know me, always looking to refine and improve our methods.
Great. Okay. Whatever.
Thank you, Hawks. I appreciate it. So how's your own work going? I've heard about that new case you've been working on.
Yes. Let's just say it's a bit of a puzzle, but one I'm determined to solve. Speaking of which, I think I might have figured out what's wrong with my patient after all.
Oh, really? That's fantastic news.
Yes, it is. Well, Johnson, it was great catching up and discussing our work, but I've got some things to attend to. See you around the hospital.
Yeah, sure thing, Hawks. Take care.
I apologize for my unprofessional appearance, but I'm here to set the record straight. Walker-Warburg syndrome was a mistake.
You're not wearing proper protection. You could be exposed to infectious agents.
We need you to wear protective gear before stepping into an operating room, Hawks.
That's right. Your safety is paramount plus in this environment.
This isn't an ad, Frank. Shut up.
I know. And I appreciate it. But let me explain my reasoning for a moment. Walker-Warburg syndrome was the incorrect diagnosis for our patient here. Instead, it's pemphigus vulgaris.
Pemphigus vulgaris. How did you arrive at that conclusion?
Well, I had lunch with Dr. Johnson and he helped me understand the symptoms better. Pemphigus vulgaris is a more accurate diagnosis given their condition.
No, let's focus on treating them accordingly.
Is pemphigus vulgaris when the pemphiga begins making vulgar remarks and swears?
Boy, we need some new doctors here.
We will get some eventually, but first things first, you need to put on your medical gear. We've got to set an example in this hospital.
Well, I got it right in the end.
Yes, you did. Congratulations on finding the correct diagnosis for our patient.
Thanks to my team's hard work and dedication, not my own brilliance.
So, if I understand correctly, your diagnostic team made a wrong call?
Yeah, they got it wrong, not me. It was all them.
You just declared the wrong diagnosis yourself.
That doesn't mean I can't have competent people working under me. They failed, but that's their problem, not mine.
So, you're saying you'd make a better doctor if only your team was less incompetent?
What do you think? How direct do I need to be to say my doctors are a bunch of worthless twats who couldn't find their ass with both hands?
Good luck hiring a new one with the kind of reviews we're getting at this hospital. Not to mention the possible defamation lawsuit I overheard in your office when I walked past it.
Not if the party is criminally convicted.
President Vermin Supreme pardoned him because Wahlberg sold him a good presidential car.
What a dark timeline we live in. That's not even funny. That car's not going to last a trip to the airport.